not received essential personal protective gears such as gloves, raincoats, gumboots, and masks necessary for their safety and professional work. The second is the measures to address technological support gap, delays in remitting stipends. If you look at the Nairobi City County CHS Act of 2019, Part 3D, we have committed through this act to for the protection of the health and safety of all the community health promoters in Nairobi County. We are currently implementing a performance-based stipend with a tool for measuring performance that is carried out every month using the electronic community health information system. And as a result of passing that at 80%, we are able to remunerate the CHPs at 3,500 shillings, which is above the match of 2,500 shillings we are provided for by the national government. This supports them to a minimum extent. However, the county, also in collaboration with other development partners, is supporting them with the primary protective gear, and in case in point, the gloves and the masks. We are also...
just a minute, Dr.
Yes.
I'm lost in your response, because we want to move a little bit fast. The question is saying, explain why CHPs in Nairobi have not received essential personal protective gear such as gloves, raincoat, gumboots, and masks necessary for their safety and professional work. Chair. Address yourself to that.
Chair, what if the question is wrong?
Pardon?
What if the question is wrong? You know, if you ask, explain why they have not received, and she's explaining that they have received, and this is what we give them.
Chair,
because
I am the one who wrote the question. It cannot be a wrong question, Governor. For a bit of background, Chair, you can see this is a very old question. We had a meeting with CHPs from Nairobi's 5 constituencies on 16th of December 2024. This question originated from those conversations we were having with them. As you can see, the question was brought before the Senate on the 13th of January 2025. This was out of the conversations we had with the CHPs themselves. Now, the question is not talking about masks. These people, you know the environment in which they operate in, including the informal settlements, and when it's raining, Governor, the way that it is raining right now, they are saying there are necessary tools for them to be able to do the job. Gumboots, raincoats, and gloves. So when they say we need these things to do our job, that question cannot be wrong.
There's a standard of what is in the kit that is set nationally. This is additional. So it's the right question. Why don't they have now gloves, raincoats, gumboots, and masks? They are given case by case, depending on what they are sent. It is not given to all of them, because you see, they cover 782 households. That's why there are 700 and how many households? 782,000 households. That's why there are 7820. And not all of those areas throughout the year would require gumboots and gloves. Beyond the standard kit, because remember, there's what the national government is doing in the county. All counties are matching 2525. But Nairobi, we increased it. We're doing more. We're doing 35. Where there is need for additional, Chair, and the director will give more details, we actually provide. But it's not a standard provision for all of them at the same time.
What Senator has asked about the gumboots and raincoats, we did a procurement in November 2023 as Nairobi County Government, and we were able to supply 1,200 of them with these commodities in response to the cholera epidemic, which we were able to control as Nairobi County. That was running then. We are able to give commodities, and particularly those around WASH, and these are commodities around the WASH response, to the CHPs whenever we have any outbreaks, and we do this with support from the county government budget as well as development partners. When it comes to the CHP kits, we receive this from the national government. We have accounted for that, and we have a distribution list of how these kits went to the CHPs.
Thank you very much.
And so,
that may help you so that in future you frame your answers correctly. You know, we are not asking for very complicated answers in the Senate. Why don't you just come to the Senate and say, you have asked about this, give us details and say, we have supplied 1,200 CHPs on this particular area, in this particular period, with the following commodities.
There is an attitude from the Nairobi County government that they can be clear clever with words, and they think we will not know what they are saying. Because what she is saying is they went out to buy gumboots after or during a cholera outbreak. You have a full complement of 7,400 CHPs, Governor. 7,400. You know their job description. You have sent them out into the estates to do this work. There are certain basic things that from the beginning you would think that they would require. That's the whole point. Even for you during the campaigns, when you sit with these CHPs, the question of gumboots has always been there. From 2017 to 2022, you talk to the same people that I talk to. So the expectation is, if you can tell us of the 7,400, 4,000 don't need them because they work in I don't know which area of this is Nairobi that you think that they will not need gumboots, because when Nairobi floods, it's all over the place.
Oh, they're not on the...
That's what I'm saying. So you will tell us of the 7,400, we have provided 4,000 gumboots for the people who work in these specific areas because of the sort of hygiene issues that are there. If somebody asks for a raincoat, Governor, which ones will you give raincoats, and which ones do you think, even if they are rained on, it's okay?
Chair, it's such a simple issue. We shouldn't split hairs.
No, it's not a simple issue. The reason why we are splitting issues is because you've decided to split issues. The response that is coming from her, she decided to tell us that they bought 1,700. She needs to tell us for whom, as the chair has framed. So can we have a conversation? Are these things that the county government thinks are necessary for these CHPs to be able to do their job? And if they are, then we say only 3,000 of them need it. These ones don't need it. And if you can be able to give us that breakdown of what has been done. So unless there is another cholera outbreak, can the remaining 6,000 or so...
I think you have made your point, Senator Sifuna.
Gumboots.
Let me just allow some small clarification, then we go to the question number 2.
If something can make them work better, I'll be the first person to do it. We shall provide additional. What we said was the essential, the basic essential that's a national standard has been provided. We shall do more. I think it's a fair case. You know, we shall do it.
Very good. Now let's go to question number 2.
Number 2 was the measures being taken to address technological support gap. Chair, long and short of this is that we have 7820 CHPs. The provision by, these devices are being provided from the national support. They provided for fewer than they are. So there's been a push as COG because it's throughout the counties, it's not just in Nairobi, because you want standardized equipment. And so that procurement is being done at the national level. I think the support from one of the organizations, is it CIF or who is it? One of the...
Yes, it's CIF, yes.
Child Investment Foundation Fund are the ones that procured that for the national government. So they will bridge that gap for all CHPs across the country, including Nairobi. The next question.
So maybe, Governor,
yeah.
So how many were provided for Nairobi? Because then it makes it possible for us to make a follow-up with the ministry.
Yes, thank
because
you.
it's their work.
So 7,502 were provided with that, with the devices. The gap, therefore, is the difference with 7820.
Chair, the question also covers the qualitative aspect of the devices themselves that have been provided. The conversations with the CHPs that it is old technology. Most of the time it's unreliable, it's failing. So maybe you can address that as well in terms of the quality of the technology itself to be able to do actual online reporting. Because when we were with them, the demonstrations there, those phones hang 90% of the time, Governor. And it makes their work very, very difficult. So maybe you can address that as well. Instead of buying the machine for chapatis, maybe we should buy iPhones for the CHPs.
Chair, this EACHES program is national. The ones providing the software, the devices, some say even the bundles. And Chair, we have been insisting as COG and as counties, just leave that entire thing to counties to do, because we can provide software, we can then look at the quality of, it should be left to us. I'm glad I've seen what you passed recently, that you've put the entire now stipend from the national government as a conditional grant to come to the counties. Because even to the next question, there's no delay of stipends from the county government. We never delay, not even once. There's no month that they have not been paid. But the national component sometimes can take 2-3 months and then it comes in lump sum. But the county one has never gone beyond a month. Sometimes it might be late in the month. Because I I said it very clearly that no CHP, or rather that I, as a governor, will not be paid before CHP as a stipend. We're on the same payroll. So I am paid on the same day, the CECs, the directors, and the CHPs. We're all paid on one payroll on the same exact day.
There is a question that I was asked to specifically put to you by those CHPs. They understand that the component that delays is from the national government component, right? And county governments, I think including yours, whenever the disbursement of equitable share delays, you have found ways to make sure that you pay your people. That's a fact. Why are they not included in the similar program so that you are able to pay them the full one, covering even the bit by the national government, and then when the money comes, you're able to deal the same way you deal with salaries when there is exchequer delays?
We can look at it for the government component when it delays. The only issue that I foresee we would have is with COB approving that difference, but it's not a big amount. It's something we can explore, definitely. That's what we can cover for national when the money comes. But now that it's a conditional grant, again, the exchequer delays really hold counties back, But covering for the national government 2.5, if COB allows, we can be doing it. And then when the money comes, we now take it back to our CRF for other purposes. But I think that's a very good idea. No, those number 4. On why CHPs have been required to conduct SHA registrations for the public without adequate facilitation. That's an issue they have raised. It's an issue I've also raised similarly at COG. I feel that, you see, the 2.5 that comes from national shouldn't just be an assumption that then they take on any other additional task. Because, Chair, taking care of 100 households for one person is actually a task. And this network of CHPs is so critical, because they know this house has this issue of diabetes, this other house has this. So there should have been some facilitation.
But Governor, I agree there should have been some facilitation. But how about if we ask the CHPs? Just in the 100 households they are taken care of. Ensure the 100 households are registered in SHA.
That's what
so that as they go about their work, in terms of checking on these other things, they also make those inquiries. But I don't, of course, we are not saying they don't deserve additional thing, but it also enhances the healthcare, provision.
Chair, this, things improve with time, When I came to this house, we were at 15 billion. We left it at now 18. My Senate has pushed it to 20. Chair, CHPs were getting nothing. I brought a motion. We started as Nairobi. Now they're getting something, 3.5. Ideally, CHPs should be at minimum wage. The next question is efforts to enhance training for CHPs on use of electronic community health information systems to ensure efficient reporting and awarding of marks. Chair, we have the CHPs report to CHAS, Community Health Assistance. We have employed additional, we've promoted actually some of the CHPs who've shown leadership. They've shown ability to manage teams and to train others. So those ones have been promoted to actually be employed as community health assistants. These ones are now as county employees. They're trained on the system, and so they serve as the supervisors. They're providing mentorship, coaching, training on niches to CHPs on a day-to-day basis.